While our president may have dismissed Africa in derogatory terms, many people of faith understand the resilience and dignity of the African people. Through its partners in churches and the community, Pan-African Rural Health and Social Services, or PRHeSS, is dedicated to improving health care and economic development in rural Africa. To hear about their work in Sierra Leone, let's welcome Dr. Sam Kamoa, founder of PRHeSS, who led a recent mission trip to the country, where the organization helped build a community hospital and vocational school. We also welcome Yvette Black, a local and regional president of United Methodist Women, a PRHeSS partner. Yvette was part of the trip to Sierra Leone. And we welcome Rick Thurneau, past district governor for Rotary International, another PRHeSS partner. Can you tell us how PRHeSS began?
PRHeSS began as a service organization. We started from the pews of what used to be First Wesley Academy UMC Church, now called Transformation United Methodist Church, Community United Methodist Church. We started with nothing put aside but just trusting God, because there was so much chaos and terrible things happening in Sierra Leone after 11 years of civil war. So we prayed together, and I decided to go to Sierra Leone with my wife to see what was going on, how we could help. We went and saw the need was so immense out there. So we came back and said, well, it's about time we started doing something for this country that's going through so much trouble. So we started PRHeSS. And by God's grace, we had a pastor who was really mission-minded, who inspired us to continue doing what we were doing. The whole congregation was behind us in support. So that's how PRHeSS started. So we can change the situation. We can help people back in rural Sierra Leone with what we are doing, and set a model, as we call it, Pan-African Rural Health and Social Services. It's not just for Sierra Leone. We want to set a model for the whole of rural Africa, because all rural African communities suffer the same thing, same problems of poor health situation, no enough medication, no health care facilities for them, no clean drinking water for them, poor school system. I mean, it's a common trend for all rural African countries. African countries is where they take care of their cities, where visitors come often and they get impressed by what they see. But the rural areas are completely forgotten, and they all have a common underlying problem, which I just named. So that's how we started, and up to now, this is our goal, that we can improve situations for people and empower young people getting up, and also be role models for the young people. So by the time we are dead and gone, there will be people enough who have the passion to help one another, to continue this going even after our own days in life.
Let's bring Yvette into the conversation. You are in partnership with PRHeSS with the United Methodist Women.
Well, not just with the United Methodist Women, personally.
Okay, tell us more. Because
I'm a member. I'm a card-carrying member of PRHeSS myself. From, as you said, Dr. Kamoa and I belong to the same church. And over the years, people in the church have been supporting things. First through things because you can sponsor a child in Sierra Leone. It costs $10 a month to sponsor a child, $120 a year. So I sponsored a little girl. And over the years, she would send me letters and pictures of her, and I never had an opportunity to meet her. Then when they started to work on the hospital, they wanted to build a women's wing. The bricks for the women's wings were 50 cents a piece. So the United Methodist Women, helping women, was part of what our organization does, women, children, and youths. So it was just natural that fit. So we raised the money for the 4 walls for the women's unit. And I went because I wanted to see the women's unit, but also to firsthand see some of the conditions and things that Dr. Kamoa and his wife Mary were talking about. I took my granddaughter, who was 22, it was an eye-opening, amazing experience for both of us. That's how I ended up there. The people are warm, they are very hospitable, they are very giving, even of the little stuff that they have. My favorite story is the family for the little girl that I sponsor gave me as a gift a goat. They brought me a goat. Now, you can imagine how important that is, because goat is part of their food. They tied him up, they came in, we were supposed to slaughter him and have him for dinner, but thank God he got away. I couldn't have eaten him, but that's how they were. They give. We visited the hospitals, I visited the school. When I was in the school, I asked one of the children if they could have 3 things, what would they want? And the boy said, lights in their school, books for the children, and someone to sponsor them beyond elementary school, because they need sponsors for books and things beyond elementary schools. And if you can imagine 15,000 Leones are $2 American.
Wow.
And so you could sponsor a kid for like $75 a year through school. Who could not want to do that?
I'd like to bring Rick into the conversation and the role that the International Rotary has played in this partnership with PRHeSS. Can you speak to that a little?
Absolutely. Rotary is an international organization, but it's a bottoms-up organization. So Sam and I belong to the same Rotary Club, the Rotary Club of Homewood, and Sam came to our club to explain what his vision was. We got on board with it. We went to our Rotary District 6450, and they also got on board with it. And through a grants program from the club, district, and the international level, all 3 entities ended up contributing a total of $90,000 to support all the efforts that Sam and his team are doing in Sierra Leone.
That's fantastic. So those efforts would include the hospital, the school. Why is this important for you?
It's important for me because all of us in the United States are so blessed. And until you go to the third world, you go to Sierra Leone, you go to Haiti, and you go to a lot of other places, you really don't see what the real world is. Over half the world makes less than $2 a day. And as Yvette said, it doesn't take much cost-wise to educate a child. And that's true around so much of the world. And just one of my goals in life is to make a difference. And all it takes is one individual with an idea, sharing it with someone else, and we all can change the world together.
What about some of the people that you encountered, Yvette? Can you share a story of maybe 1 or 2 people that really stood out to you while you were there?
There were so many. When I went to Sierra Leone, I sponsored 1 child. When I came back, I sponsored 3.
Wow.
And one of them is the sister of the girl that I had previously sponsored. She has seizures. And one of the problems is it's not always possible for her family to get medicine for her seizures. And so I thought, I can at least work on that. I can't even begin to express to you what a wonderful, warm feeling it is to be able to do something. Each one of us can't do everything, but each one of us can do one thing that makes a difference.
Thank you, Dr. Kamau, Yvette, and Rick for being here today and sharing your stories of the global impact that you're making in Sierra Leone. I'm LaShondra Stevens for Different Drummers and the Greater Chicago Broadcast Ministries. Keep the faith.